Good morning, everyone. Can you all hear me? Just give an indication. My name is Derrick, and I am the ethicist at the Caribbean Public Health Agency, CARPHA. This webinar series is being put on through a joint effort of PAHO, the Pan American Health Organization, the Caribbean Public Health Agency, CARPHA, and the Bioethics Society of the English-Speaking Caribbean, BSEC. Over the past 2 Wednesdays, our webinars have been looking at the history and importance of research ethics and what makes research with human participants ethical. Today, we wish to look at a more fundamental issue. What is research? This is the basic plank upon which our endeavors are based. Now, I will invite you at various times throughout this morning's session to participate by typing in the left bottom hand corner of your screen. So as we go along, I'll be inviting you. We won't be able to facilitate oral because of the broad bandwidth necessary. So we'll be using typing, and I'll speak answers and we'll discuss that way. So, to answer what is research, we therefore need to have a clear idea of what constitutes research. As such clarity will help us to decide exactly what we are embarking on, what to expect from a particular endeavor, what we can explain to others regarding this endeavor, and what kinds of activities should be subjected to prior review by a research ethics committee. To do this, firstly, we need to have a clear understanding of what constitutes medical treatment for humans, what constitutes research with human beings, and the difference between the two. Many of you will know that medical treatment is geared specifically towards the individual patient. It aims specifically to benefit the patient sitting in front of the doctor, whilst research aims to benefit a larger group of people, usually the society, and is not geared towards the individual person. Further, we need to have a clear understanding about activities that collect and analyze data for surveillance, for health impact assessment, and for quality improvement assessments. We then have to determine which activities need to be reviewed and approved by a research ethics committee. Research with humans include any social science, biomedical, or epidemiological activity that involves a systematic collection or analysis of data, which has the intent of generating new knowledge, and which involves human beings that are exposed to observation, intervention, manipulation, or other interaction with investigators, either directly or through an alteration of their environment, or become individually identifiable through the investigator's collection, preparation, or use of biological material, or the use of medical or other records. So, to do so, I've simplified it for your consideration. The criteria involves 2 simple features. 1, data collection, which is to be used for new knowledge, and 2, human beings that are involved in the process. Issues such as whether individuals may be personally identifiable help to determine the relative risk of harm. And so, if we look at how to avoid confusing uncertainty with research, the primary intent of research, as we said before, is knowledge production. However, the specific aim of an endeavor is also important. Innovative treatment or small experiments in treatment is meant to benefit the particular patient, while research is undertaken to produce new scientific knowledge that benefits large groups of people. The intent, thus, is crucial and has moral significance as well as operational consequences. In public health, research may involve whole communities or populations, and as the social determinants of health are very important, increasingly a wide range of information may be collected from populations, including demographic and health surveys. While some of these surveys may not be regarded as research, since their purpose is to guide policy rather than generate new knowledge, because they often include research questions, then the distinction between what is research and what is not is often blurred. If we look at the matter of human welfare, the production of scientific knowledge does not relieve the researcher from the obligation to protect all human beings who serve as research participants. So, whilst an immediate mission may only be the collection of data or samples and specimens for data banks, research participants might agree to take part in the collection of the information on the mistaken assumption that investigators come from the health field, and so are always, because they come from the health field and they carry the potential to provide health care or access to health care, then they are there specifically for treatment. This is called therapeutic misconception. Further, small-scale formative research that is carried out before the conduct of full-blown clinical trials have the potential to cause harm or embarrassment to whole communities. Research can also cause harm, other types of harm, as we have seen here, that may not be so obvious, such as socio-behavioral investigations that explore sensitive information about participants' conduct, which could cause the actions or responses of the participants to become known to others, bringing about social or psychological harm. And so, what is the mandate of research ethics committees? As we learned in our first webinar, the history of research endeavors has shown that judgment about participants' well-being should not be left solely in the hands of researchers. And so now, independent committees called research ethics committees or institutional review boards, IRBs in the USA, are required to evaluate research protocols and balance the risks to potential participants and research communities, and balance that against the benefit to society for each particular research endeavor. We should note that a research ethics committee may choose to waive a full ethical review of the proposal, even if the activity is research, because it may determine that the proposed study does not pose much risk to participants, such as in an anonymous telephone survey. However, it is not always easy to determine the level of risk, as even surveys and questionnaires may put participants at risk for repercussions. And so let us look at the specifics of the case that we will be evaluating today. This is case number 2. What is research? It is to be found in the case book on ethical issues in international health research that was written by the World Health Organization, WHO, and this particular case is to be found on page 43. The headline is Evaluating Sexual Health and Family Planning programs. So the case. I'll be reading it in detail, but the slides will show you the summary of each important point as we go along. The Institute for Family and Youth has a contract with a bilateral funding agency to implement family planning and sexually transmitted infections, STIs, and HIV prevention programs in developing countries. The funding is conditional on inclusion of an evaluation component. Through its Healthy Ideas program, the Institute has recently established 3 public health prevention projects in developing countries. The first prevention project, is an HIV testing and counseling program for adolescents with sites in 1 country in each of 3 regions, in Eastern Europe, Sub-Saharan Africa, and Southeast Asia, which will be evaluating using questionnaire surveys of adolescents over a 3-year period to investigate frequency and types of drug use, sexual activity, and sexual preference. The second project will provide prenatal care to a poor urban community located in a country where HIV infection is still highly stigmatizing. The evaluation component will examine the frequency of partner notification among married and unmarried women whom the clinic diagnoses as HIV positive. The third is a condom education project, which will be located in a South American country, and actually a South American city, with rapidly rising incidences of STIs and HIV. It has been modeled after a 100% condom use program found to be effective in Southeast Asia, in which graduated sanctions are imposed on brothel owners based on the rates of STIs found among female sex workers in those brothels. Ultimately, the brothel runs the risk of closure if sex workers repeatedly get STIs. An evaluation is planned to assess the feasibility of implementing the condom program. The Institute for Family and Youth says these projects do not need clearance from a research ethics committee because the activities are low risk, do not test an intervention, and are operations research, not biomedical research. The head of evaluations at the Institute cites human subjects research regulations in the United States of America, under which she believes ongoing evaluations of actual interventions are not subject to ethical review. She also stresses that the findings of the evaluations will be used to help design better public health programs for the other sites where the Institute runs disease prevention programs. And this leads us to the questions. First question, are any of these projects research studies? You wanted to explain why you believe they are research studies or why not. Second question, what distinguishes research from ongoing evaluations of public health interventions? Third question, does these activities require any ethical oversight? Ethical oversight means that not only will the Research Ethics Committee be involved, but they would continue to follow the project to make certain that the participants do not come to any harm. Fourth question. The Institute for Family and Youth says that these projects are low risk. Discuss what is meant by low risk in the context of an ethics review. And the second part of this question is, does the level of risk affect whether or not it needs to be reviewed? And so let us analyze this case. Question 1 asks you specifically, are any of these projects research studies? Explain why or why not. So, let us look at the first project. The first public health prevention project is an HIV testing and counseling program for adolescents that has sites in each of 3 regions: in Eastern Europe, Sub-Saharan Africa, and Southeast Asia. The project will be evaluated using questionnaire surveys of adolescents over a 3-year period to investigate frequency and types of drug use, sexual activity, and sexual preference. Is this a research study? Please now type your answers in the bottom left-hand corner and let us discuss. Colin says yes, and the second half of the question is explain why. Why do you say yes? Colin says there is a survey with follow-up. Does everyone agree with that? And if not, tell me why. I'm not saying it's right or wrong. Give us your opinion. Persons are responding saying yes, it's a research project. We need to know why they think it's a research project. Okay, data are collected for surveillance, there is intervention, there is need to ensure that the participants are protected. Other ideas, other suggestions? Okay, to answer this, let's look at the simple qualification criteria for research that I mentioned at the start. 1, the project involves data collection that will be used to generate new knowledge. And 2, the project involves human beings. And so in this project, data is not being collected for the purpose of surveillance, nor for health impact assessment, nor for assessment of quality improvement. Instead, adolescents will be questioned regarding the frequency and types of drug use, their sexual activity, and sexual preferences. Further, the adolescents will be in direct contact with the investigators, and so they will be individually identifiable through the investigators' collection of data on them. So, I agree with all of you who said this project meets the criteria for a research study. This slide captures all I said a while ago. So, simple criteria, it involves data collection, will be used to generalize new knowledge. It involves human participants, and since it is not being used for survey, health impact assessment or assessment, it in fact generates new knowledge, so it is research. The second project. This would provide prenatal care to a poor urban community located in a country where HIV infection is still highly stigmatizing. The evaluation component will examine the frequency of partner notification among married and unmarried women whom the clinic diagnoses as HIV positive. Is this a research study? Explain why you think so or why not, providing your reasons in the bottom left-hand corner. Any thoughts on this second project? Is it a research study? It plans to provide prenatal care, but there is going to be an evaluation regarding partner notification, married women or unmarried women, whether they will tell their partners. What are your thoughts? This one is more challenging. I see no responses. Well, at least one person is there, and Nicola just joined the session. So I at least expect one response. Okay, I see the response now. Yes, yes. Okay, good. Another person disagrees. All women are receiving the care. Another person says it can be considered a research study geared towards intervention. Yes, it is collecting data outside the care option being given. I like that answer. In my view, there's a regular routine public health exercise. Reflects another view. New knowledge. Yes. There's the ability to identify participants individually. New knowledge that involves human beings. Okay. I like all these answers because even the person who says no at least picked up the important point that they have to use to make the judgment. So my answer. In using the same simple criteria, this project collects data, it involves human beings, but the question is the aim to generate new knowledge? So this clear is not so clear as black and white. The evaluation component seeks to ascertain how often women who are diagnosed as HIV positive go on to inform their partners. So the answer, in my opinion, is yes. This is research as it seeks to find answers about the habits or practices of women in this particular community that were not previously known. The third project is a condom education project, which will be located in a South American city that has rapidly rising incidences of sexually transmitted infections and HIV. It has been modeled after a 100% condom use program found to be effective in Southeast Asia, in which graduated sanctions are imposed on brothel owners based on the rate of STIs found among female sex workers in the brothels. Ultimately, the brothels run the risk of closure if sex workers repeatedly get STIs. An evaluation is planned to assess the feasibility of implementing the condom program. Is this a research study? Please type your answers. Any answers? Any answers being proffered for this particular third project, condom education project?
A response.
No, this is not a research study. It is an evaluation of the feasibility of undertaking the project. Fair enough. Now the answer looks towards reducing STDs, sex worker, reducing rates and providing services to such groups. Now the answer, this may be formative research. Another person is having problems with typing, but I think we get the general idea in this regard. While it is interactions with humans, it is not so clear as to whether new knowledge is being gathered. Fair enough. Next, this should qualify as research. Human beings are involved as it appears that new information could be collected. That's another view. If the sex workers will be tested for STIs to determine the rates and impact on this from condom use, then yes, it is a research project. It involves human beings. Okay. Some type of research would have been conducted before the education program is implemented. That may well be so, but we are being asked to specifically answer what is put towards us, not what might have gone before. So we have to use the data that is provided to us. So my answer, using the simple two-pronged criteria, this project does involve human beings, but will be an evaluation regarding whether it is feasible to implement this condom education project. As no new knowledge will be generated, then my answer is no, this is not a research study.
Any dissenting opinion?
Oh, any dissenting opinion? My view is that it is a feasibility study and therefore no new knowledge will be generated. I say an okay. So we move on to question 2. What distinguishes research from ongoing evaluations of public health interventions? Please type your answers in the bottom left-hand corner. What distinguishes research from ongoing evaluations of public health interventions? Gathering new knowledge, yes. New information together with the collection of empirical data, very good. New data. Well, data can apply both in terms of new as well as data to inform government and policy. So that's not specific enough, Colin. Research is always geared at answering new questions, true. The intent, yes. New knowledge is gathered from research, yes. New ideas, direct causes, barriers, etc. way forward, private, public, NGOs. I suppose you're referring to the research endeavor. The first is introducing new knowledge and the other is more of an assessment, fair enough. Research is generating new knowledge, Cecilia. Fine. I think you all get the general idea. Research is undertaken to produce new scientific knowledge. And in public health research, this may involve whole communities or populations, but still it is new knowledge. On the other side of the issue, governments are often keen to collect a range of information from populations in the form of demographic and health surveys. Most of these will not be regarded as research. However, as their aim is to guide government policy rather than generate new knowledge. Consequently, as one of our participants pointed out a moment ago, the aim or purpose of the endeavor is important. The word that the person used was intent, as well as the methodology undertaken. Let me re-emphasize that. The aim or purpose of the endeavor is important, as well as the methodology that is to be undertaken. We should note that if the methodology of the survey includes questions that are research in their intent, that is, seeking to produce new knowledge, then that will blur the distinction between health surveys that are mainly to guide policy and surveys that can be classified as research. So we always have to be looking out for that type of distinction. There's a question here: what distinguishes the methodology from any other form of research? Methodology describes the method that the researcher or researchers will use to go about the work. So if the method involves a particular pathway that will produce new knowledge, in other words, if say it is in the form of a survey, but the questions asked will produce new knowledge, then it actually has research built into the component of the general survey. So you always have to be looking for that. If all the questions are just going to be of the nature that will inform policy guiding, or if there is new knowledge that will come forth, then that is research and falls within the category of research oversight. So, question 3. Do these activities require any ethical oversight? 1, the first activity, that project is an HIV testing and counseling program for adolescents. In regards to this particular project, please give your answer. Does this activity require any ethical oversight? Kellyanne says yes. Remember to provide your reasoning. Indeed. Okay. Well, we're all in agreement, it appears. Yes, anonymity, consent, etc., etc. Right, you're getting all the ethical elements that are important to consider. Very good. So, in answer, my answer, we have already determined that this project constitutes research, as it involves a questionnaire survey of adolescents that will produce new knowledge. And so we can conclude that it will certainly require ethical oversight. The next project. This project is to provide prenatal care to a poor urban community that has high stigmatization regarding HIV infection. It will also require evaluation. They will intend to evaluate how often women notify their partners when they are diagnosed as HIV positive. Do you think this activity will require any ethical oversight? I invite your answers. Yes. Informed consent. Privacy and confidential matters by healthcare practitioners. I think so, yes. Yes, to protect the participants. Yes, confidentiality. Yes, okay. Well, I think you have all deserve an A. You have all the ideas, you have all the concepts. We have already said that this is seeking new knowledge regarding the habits of women in that community. So ethics oversight will be required. But let us look deeper. In this case study, we are not provided with the details of how this process will be done. So my aim is to guide you on how to think on such matters. Your primary aim, whether as a researcher, policymaker, or member of a research ethics committee, is to ensure the well-being of any human participants in whatever project you are engaged in, supervising or evaluating. In this specific instance, the matter of HIV is involved, which we know still invokes high stigmatization in many communities. We therefore have to ensure that individuals who are HIV positive are not personally identified. Hence, in this project, the description provided in the methodology will give us an idea of whether there might be a risk of third parties knowing the identity of HIV positive persons. Whenever there is any doubt, there should be a full review by the ethics committee. The final project is the condom education project, located in a South American city with rapidly rising incidences of STIs and HIV. Does this activity require ethical oversight? Your thoughts, please. Rhonda says anonymity and confidentiality. Do you think this particular activity, the condom education project, requires ethical oversights? Any other thoughts? No, if this was only a feasibility study as indicated, fair enough. Very limited, not certain in what sense you mean, Colin. Kellyanne says no. Indira says raising awareness, main issue, so it is not research, I suppose. That's what Indira meant. Informed consent will still be important, says Cheyenne Campbell. Claudia says no. It's looking at feasibility, so the answer is no, says Kellyanne. And Yboisson says no, it's not research. Fair enough. So the question is, does this activity require ethical oversight? My answer, even if the method reveals no new knowledge will be generated, we should be very careful as we still have persons involved in the sensitive matter of STIs and HIV. However, we should also note that the project here aims to assess the feasibility of implementing a condom program. So, whilst we are not provided a methodology for doing this, if we are to assume that there will be no contact with individuals, such as the female sex workers in brothels, and that the identity of brothel owners are not at risk in the feasibility study, then this project, in my view, would not require ethical oversight. Additional comments, an initial ethical review is necessary. Fair enough, Colin. No, research not requires oversight. Feasibility includes needs oversight. Once you right, okay. So I had said at the beginning, or somewhere in the first part, that I was distinguishing two things. Initial review by an ethics committee and ethical oversight, which I extrapolated to mean ongoing monitoring. In other words, the project is reviewed as it progresses, ethical oversight for the project. So there's an initial review, and then if you deem that there is more than minimal risk, if you give approval, but you think that you still need to follow up to ensure that persons don't come to harm, then there's the oversight of the project. And it is within that context now that my answer is no. This particular project would not require any ethical oversight because it is a feasibility study. And therefore we're presuming, I put in the riders. Once the methodology, from the methodology, we are convinced that no contact will be made with individuals, such as the female sex workers, and that the identity of brothel owners are not at risk in this feasibility study, then we as members of the Research Ethics Committee would not need to keep looking over the shoulders to ensure that persons don't come to harm. It is within that narrow context that my answer should be interpreted. So, moving on to the final question within this particular case. There are two parts of the question. The Institute for Family and Youth says that these projects are of low risk. Discuss what is meant by low risk in the context of an ethics review. And the second part is, does the level of risk affect whether or not it needs to be reviewed? What are your thoughts on this? What is meant by low risk when we are thinking of an ethics review of a research project or research protocol or research proposal? And the second question is, does the level of risk affect whether or not it needs to be reviewed? One of the things that in this case, psychological and physical harm are limited. Low risk means that it is unlikely that the participants can be harmed. Low risk still needs review, like that answer, Celia. Low risk of harm of any type to the participants. Harm to the participants is minimal. That's also something we can talk about. Low risk means the risk of harm to participants is low, however, this does not affect the review by the ethics committee, very important point. Low risk, no risk to participants. I'm going to address that point specifically in my answer, Roanna. Celia, very low probability for any type of harm to participants. Some may take umbrage with that, but we'll come to that. Low risk related to invasive procedures not being done, fair enough. No foreseeable harm and little discomfort. Low, very little other people knowing or people being aware of the issue. Many people are rated to say it's low because of many reasons. Irrespective of the level of risk, it must be reviewed, fair enough. But review is necessary. So the general idea is that there should be review. Most people, well, some people tried to say what is low risk, and I'm not certain that that there was a connection between the level of risk and whether it should be reviewed. Oh no, yes, they said it should still be reviewed. Agreed. Okay, our review should be conducted despite the risk being low. Fair enough. Okay. Irrespective of level, the review should occur even if it is an expedited review. I'm going to expand on that. A review should be conducted despite the risk being low. Fair enough. I think you all get the general idea. So, My answer. In the context of an ethics review, risk refers to the probability or likelihood of harm, of loss, of injury, or some adverse outcome occurring as a result of someone participating in the research endeavor. We should note that there are several types or forms of risk. Risk may be physical, may be emotional or psychological, may be social, may be legal, or socioeconomic, financial. Further, in the research ethics arena, we put risk into three categories: minimal, low, and high. Minimal risk is the least possible risks. There is no category known as no risk, because no such thing exists. There is always some low-level amount of risk, whether it be emotional, as in the risk of participants being apprehensive or nervous or some similar state. So the category is low risk, of minimal risk, because there is no such thing as no risk. Once someone is involved in research, there will always be some apprehension, some level of nervousness, and so on. So it is low, it is minimal, but there is some level of risk for the research participants. So, minimal risks describe procedures such as questioning, in which case they may be apprehensive, etc., etc. Observing or measuring participants in a subject area that is not controversial, provided the procedures will be carried out in a sensitive way, and that informed consent will be sought and given. Other procedures with minimal risk include collecting a single urine sample or using blood from a sample that has already been taken as a part of a routine medical case management. Low risk. This describes procedures such as those that cause brief pain or tenderness or small bruises and scars. Research endeavors that involve injections or venipuncture, that is, taking blood from veins, therefore generally fall into this category. High risk. Clinical trials that use experimental treatment agents are classified as high risk. Within this category also falls procedures like arterial puncture, that is taking blood or putting devices into arteries, putting medical devices into arteries, as well as lung or liver biopsy and cardiac catheterization that are not justified for research purposes alone. Research procedures such as these should only be carried out when the research is combined with diagnosis and treatment that is intended to benefit the specific research participants concerned. And so that is what we always have to bear in mind when we seek to classify. We know that there is going to be risk, but is it minimal risk, such as a person being apprehensive about being questioned, or if we're just observing them in their natural state, or we're doing measurements for them, and that of course informed consent will be obtained. And of course low risk when we decide we have to collect blood from venipuncture or so on, or any activity that will just cause brief pain or tenderness or small bruising. And high risk, as we said, as in experimental treatments or things that carry high risk of harm, physical harm or other types of harm. And so the final question, does the level of risk affect whether or not it needs to be reviewed? What are your thoughts on this? Does the level of risk, we just mentioned 3 categories of risk, does it affect whether or not the research proposal needs to be ethically reviewed by a research ethics committee? Colin says no, it does not affect. Once it involves human subjects within a level of risk, it should be reviewed. Wonderful, very good, Kellyanne. No, once it is research using, yes, agreed. Okay. Level of risk determines type of review, but it must be reviewed. Wonderful. You all are spot on. You've gotten the clear idea. And I'm going to ask to pass it on. Each one teach one. Wherever you are, whether you're researching on research ethics committees or researchers, etc., spread the word, all your knowledge that you've gained, spread the word. We're trying to increase research ethics capacity across the Caribbean. So, everybody agrees this needs to be reviewed. So, there's a little distinction I wish to point out. Let's focus on this question. Does the level of risk affect whether or not it needs to be reviewed? The answer is no. The level of risk will determine the level of review that the project receives. But it must be ethically reviewed once research with human participants is involved. Now note, this ethical review may be expedited, such as when the chair of the Research Ethics Committee determines that the project involves minimal risk, and so does not need ethical review by the full committee. 2 or more members of the committee may be asked to evaluate and report on the protocol. This is called expedited review. When there are technical issues or the project involves more than minimal risk, then it should go to the full ethical review by all members of the Research Ethics Committee. Are all slides available? All slides will be available after this presentation, yes. And we are all agreed that it should be submitted to reviews. The chair will decide if it's an expedited review or if it's going to be a full ethics committee review, depending on the level of risk involved. So, in summary, in looking at this case and trying to learn what is research, we can conclude that, 1, the primary intention of research is knowledge production. And so the aim of the project or proposal is pivotal and crucial in determining whether it is classified as research. 2, the purpose of some public health surveys may be to determine policy, but we still have to be careful when we look at them, as they may contain some research questions. 3, participants should be told clearly whenever information is being gathered for research, as their informed decision is vital to the process. And 4th, public health and other surveys may have personally identified questions that may unintentionally cause harm. And so we must be cognizant and be very careful of this. There are some answers that are there that I think speaks to what we have said before. So I would just like now to thank you for your kind attention and for your question and answers that have been proceeding. You have been typing in your answers, and I think we have had a very informative, interactive case discussion. And since we only have 2 minutes left, I'd ask if there's any more outstanding questions or matters that person would like to raise at this point in the remaining minute or so. In the meantime, might I invite you to prepare for next week's presentation, when we will have another case discussion. This one will be on problems in research design, being presented by Professor Sharon McPherson of the Bioethics Society of the English-speaking Caribbean. So during the course of this week or next week, we'll send you the details of that case. Dr. Bolastic right now is typing in something related to that, but it's just for you to know, if you can read up ahead on this particular case, we'll send it to you by email, and Professor McPherson will discuss problems in research design at our next webinar next week, Wednesday at 10 a.m. Trinidad time and Eastern Caribbean time and Washington DC time, 10 a.m. Thank you all for your interactions. We look forward to spreading the word about research ethics and how we go about it. Thanks for your participation and have a very good day. Derrick here and signing out. Bye.